Every year, approximately 21 million Americans undergo surgical procedures that require anesthesia to put them to sleep. But several studies suggest that thousands actually remain awake during surgery.
Oh my, and these cases of anesthesia awareness are typically unintended. But tonight, Christy Kruger brings you the story of a South Florida doctor who intentionally kept his patient awake during heart surgery.
In an operating room at Mount Sinai Medical Center, Dr. Juan Carlos Londono is performing an operation he's done many times before, but this time with an unconventional twist.
Over the last 2 or 3 years, we have been doing most of these procedures now with the patient essentially awake.
Dr. Londono's patient this time is 29-year-old Christos Mihos, a medical intern at Mount Sinai, who was diagnosed with an atrial septal defect, basically a hole in his heart.
It just kept getting progressively worse, where I felt like I was breathing through a straw. Anytime I'd exert myself, I couldn't catch my breath.
And the pressures are essentially normal.
The doctor repaired the defect with a minimally invasive procedure that allowed him to just use local anesthesia and keep Christos awake.
You're allowed to almost be a participant in your own procedure. So you're allowed to actively either give feedback or you're getting information that you otherwise wouldn't get.
Sometimes mild sedation is given, and then that keeps the patient at a twilight zone without falling asleep and being able to follow commands. Artery samples.
Along with being able to give direction and converse with the patient, the doctor can also gauge the level of comfort.
We want to know if the patient is feeling pain. With general anesthesia, we don't know if the patient is feeling pain. If a patient is feeling pain during a procedure, that we're doing something that is causing that, and we want to identify that issue.
But what else?
Christos says he felt no pain and remembers about 90% of what transpired during his operation.
I mean, I guess, live in the moment, so it was interesting. It was definitely a surreal experience.
Christos was able to avoid all the problems associated with general anesthesia, and he recovered quickly. In fact, he was out of the hospital in 1 day and back to work within 1 week. Great news for him. I'm Christy Kruger, Local 10 News.
And right now, Dr. Londono is only doing this procedure on certain patients with an atrial septal defect. But he says advancements in both surgical tools and technique will one day allow doctors to perform even open heart surgery with minimal anesthesia.
Well, it was